Welcome everyone. Today we are going to talk about stroke. I'll begin the presentation by showing a news video from 8 years ago. This video is about an early clinical trial on stem cells in stroke at Stanford University. The technology has advanced since this video was made. There have been 3 major changes. 1. The type of stem cell has been changed from adult stem cells to umbilical stem cells, which are more potent. 2. Now the treatment is delivered intravenously IV instead of surgery, which is much less invasive and less expensive. 3. Because the cells are distributed through the vascular system instead of directly in the brain, results typically start appearing 3 weeks after treatment instead of days. Let's watch the video.
We have some remarkable video to show you tonight. Stroke victims making incredible progress literally overnight thanks to a new kind of treatment at Stanford. Emily Turner is here with a story you'll only see on 5.
You know, it was a small clinical trial at Stanford that involved an experimental treatment with special stem cells. The doctors are stunned and the patients are overjoyed. 5 years ago, Sonia Kuntz suffered a stroke that severely damaged her brain.
This is Sonia's stroke.
It partially paralyzed Sonia on her right side, and she could barely speak.
Her speech was not very understandable. She couldn't order food or communicate well.
2 years later, Sonia could still hardly lift her arm, but just one day after an experimental treatment,
Oh my gosh.
Sonia could lift her arm over her head.
Can you move it to the side?
And move it to the side.
Are you kidding me?
And also to the front. And her words began to flow.
I woke up and immediately I could speak better.
She's what we call one of our miracle patients.
Dr. Gary Steinberg, chair of neurosurgery at Stanford, led the small clinical trial. 18 chronic stroke patients were involved. 12 came to Stanford, including Sonia.
I was very excited. I think I started to cry.
In the trial, Steinberg drilled a tiny hole into the patient's skull and, using a very fine needle, injected modified human adult stem cells around the stroke.
We put them around the stroke, and that's where they do their thing to recover the function.
These stem cells are created by SanBio, a biotech company located in Mountain View.
It's very exciting, for all of the people involved in this.
Scientists here derived them from the bone marrow of 2 adult donors and then tweaked them. These cells don't survive for long after the surgery, but they appear to trigger a patient's damaged brain to begin to heal itself.
The cells somehow jumpstart the system again.
Here's another stroke patient just before surgery. And here she is just days after receiving the stem cell treatment. As for Sonia, her life is back on track. She's now married and pregnant with her first child.
And it's a boy. Yeah.
Now, not all of the patients, but most of them in this study saw a benefit that has lasted. But Steinberg is cautious and wants to replicate these findings in a much larger trial. That study is now enrolling participants.
All right, Emily, thank you. Now, these results were published this afternoon in the journal Stroke. For more information, go to kpix.com.
Moving on to stroke now. Stroke is a disease that affects the arteries leading to and within the brain. It occurs when a blood vessel that carries oxygen and nutrients to the brain is either blocked by a clot or bursts. When this happens, part of the brain cannot get the blood and oxygen it needs, causing brain cells to die. Stroke is the second leading cause of death and disability worldwide. Medical risk factors for stroke include high blood pressure, elevated cholesterol levels, heart disease, atrial fibrillation, diabetes, and obesity. The signs and symptoms of stroke depend on the type of stroke and location of the brain affected. Some common signs and symptoms may include sudden confusion, with trouble speaking and understanding speech, sudden numbness or weakness, especially on one side of the body, sudden severe headache with no known cause, sudden trouble seeing from one or both eyes, sudden trouble walking, dizziness or loss of balance or coordination. Stroke can happen in 2 ways. The first is when a blocked artery stops blood flow to the brain, causing an ischemic stroke, the most common type. The second is when an artery bursts, leading to a hemorrhagic stroke, which can be caused by high blood pressure or an aneurysm. Both types of strokes disrupt blood flow, which is crucial for brain function. The extent of damage depends on which part of the brain is affected. CT scans can help identify the injured areas. Ischemic strokes appear as darker spots, and hemorrhagic strokes show lighter areas due to bleeding. A stroke on the left side of the brain affects the right side of the body, and vice versa. Once you've had a stroke, you're 4 times more likely to develop dementia compared to someone who hasn't experienced a stroke. So based on the past couple of slides, you can tell that traditional medicine and medical procedures to treat stroke are highly focused on managing the symptoms, but they do not target the underlying root cause, and nor do they focus on regaining a healthy and functioning brain. Therefore, we need to explore alternative approaches that are specifically focused on promoting brain recovery, repair, and regeneration. The alternative is stem cell therapy, which is what we will be talking about for today's presentation. This brings us to stem cells. Many people mistakenly associate stem cells with plant cells, but stem cells are unique human cells that serve as building blocks capable of becoming any cell type in the body. Stem cells are also unique in that they have the capability to both repair and replace damaged cells. There are many different types of stem cells, each with distinct properties, depending on where they are found. Stem cells commonly used to treat brain and nerve conditions come from perinatal tissues like the placenta and umbilical cord, which are both ethical and flexible sources of stem cells. These tissues, typically discarded after birth, provide a valuable option as they share qualities with both adult and embryonic stem cells. Over the past decade, they've been used to treat various diseases, particularly blood and immune disorders. This presentation will focus on umbilical cord stem cells, specifically mesenchymal stem cells (MSCs) found in the umbilical tissue. Med-Mex uses these cells for treatments, and later we'll explain why they are ideal for stroke and dementia therapy. MSCs are very promising. They reduce inflammation, are safe, and won't cause an immune reaction. They have been used to treat conditions like diabetes, autism, cerebral palsy, spinal injuries, strokes, Alzheimer's, Parkinson's, and dementias. How umbilical cord stem cells MSCs help treat stroke. They work by sending out signals that help repair the body. They use 4 main actions: regulating the immune system, reducing inflammation and preventing further damage to brain cells, protecting brain cells, releasing proteins that help protect existing brain cells, encouraging blood flow, helping to grow new blood vessels and improve blood flow to the brain, supporting new brain cells, helping the brain create new cells to replace damaged ones. These actions help treat conditions like dementia and stroke by reducing inflammation, repairing damaged cells, and may even help reduce harmful amyloid plaques in Alzheimer's disease. What are exosomes and how do they work? Stem cells are the source of healing potential. Exosomes are tiny particles, or vesicles, released by many stem cells. They tell stem cells what to do: reduce inflammation, repair tissue, promote growth, and support regeneration. The pictures on the left show the brain before treatment with a high concentration of plaques, while the right images show a significant reduction in plaques after treatment with exosomes. This demonstrates their potential in treating conditions like dementia and stroke. Exosomes from mesenchymal stem cells (MSCs) are as effective as the stem cells themselves, helping repair damaged brain tissue. How are stem cells delivered? The most common way to deliver stem cells is through an intravenous IV injection. This is safe, and the stem cells travel through the blood to damaged tissues. But some stem cells may get stuck in the lungs, liver, or spleen, meaning fewer reach the brain. To solve this, doctors might use a higher dose of stem cells and adding billions of exosomes, which are smaller and pass through organs easily. Another method is intrathecal delivery, where stem cells are injected into the spinal canal. This allows them to reach the brain without going through other organs. It's less invasive than direct brain injections and has been safely used for other treatments. The Barthel Index is an important tool we use to measure a patient's mobility and ability to perform everyday tasks independently. It focuses on 10 specific areas, such as feeding, dressing, walking. Each area is assessed based on how much assistance the patient needs. The total score ranges from 0 to 100, with a higher score meaning the patient is more independent. This index helps us define the severity of the stroke and allows us to track a patient's progress over time. Phase 1 trials conducted by leading institutions such as Duke University, the University of Miami, and MediPost in South Korea have shown promising early results. These trials have demonstrated both the safety and efficacy of stem cell treatments for conditions like stroke and Alzheimer's disease, giving us hope for more effective therapies in the future. Importantly, these trials reported no major adverse events or complications, which is a very encouraging sign for the future of stem cell treatments in this field. Researchers at the Second People's Hospital of Kunming in China studied the use of umbilical cord stem cells MSCs to treat neurological diseases. The study included both men and women, and the stem cells were given through an IV infusion. Here are the results they found. The average MMSE score, a measure of cognitive ability before treatment, was 14.7. 3 months after treatment, the average score increased to 18.0, which is a 3.3 point improvement. Normally, people with neurological diseases see their MMSE score, which measures brain function, drop by about 0.75 points every 3 months. Without treatment, the score would have dropped to 13.95. However, with stem cell treatment, instead of declining, the patient's scores actually improved by 4.05 points above the expected decline. The Barthel Index score, which measures mobility, started at an average of 29.6 before treatment, meaning the patients needed a lot of help from others. After 3 months of stem cell treatment, the score increased to 55, showing a big improvement of 25.4 points, nearly doubling their mobility. This study suggests that stem cell therapy can greatly improve both brain function and mobility, and may even help reverse brain damage, not just slow it down. In summary, stem cells contribute to treating dementia and stroke in 5 key ways. One of the key aspects of stem cell therapy is repairing blood vessels in the brain. By doing this, we can improve blood flow and provide vital nutrients to brain cells. This is crucial for preventing further brain damage, especially in patients recovering from a stroke. Stem cell therapy also strengthens the immune system, helping the body fight off harmful inflammation that can worsen conditions like dementia and stroke. Another important benefit is preventing brain cell death, which is a major factor in both conditions. Additionally, this treatment reduces amyloid plaques, which are commonly seen in Alzheimer's disease and are linked to the deterioration of brain function. Importantly, stem cells also promote the growth of new brain cells to replace those that have been damaged. Now, the combined effects of these treatments are remarkable. They work to halt the progression of dementia and stroke, reduce the likelihood of future strokes, and even reverse the damage caused by these conditions. What this means for patients is improved cognitive function, better brain processing, enhanced mobility, and greater independence in their everyday lives. Mexico has been offering stem cell treatments since 1988, with breakthroughs led by Dr. David Gomez Almaguer at the University Hospital in Monterrey. While stem cell therapy for neurological conditions like dementia and stroke are still in clinical trials in the USA and Canada, and therefore not yet available, Japan has a progressive fast-track system for regenerative medicine, allowing conditional approval for stem cell treatments, including those for neurological conditions, through the Pharmaceuticals and Medical Devices Agency. South Korea, Russia, and China have approved stem cells for neurological treatment in South Korea, Russia, and China. There is a strong regulatory framework in place for stem cell therapies. These countries tend to be less influenced by pharmaceutical interests and are more receptive to innovative medical treatments, particularly for neurological disorders. On the other hand, in the USA, European Union, Japan, Australia, and Canada, stem cell therapies are currently undergoing clinical trials. These trials are crucial steps toward eventual approvals, as these regions carefully evaluate the safety and efficacy of new treatments before granting approval. Why choose Mexico for stem cell transplants? Mexico has been offering stem cell treatments since 1988, with breakthroughs led by Dr. David Gomez Almaguer at the University Hospital in Monterrey. While stem cell therapy for neurological conditions like dementia and stroke are still in clinical trials in the USA and Canada, and therefore not yet available, Mexico has fully approved these treatments and implemented strict regulations to ensure they are safe and ethical. What makes Mexico stand out? Eligibility. Not all patients qualify, and a thorough process is in place to determine eligibility. Certified clinics and labs. Only select clinics meet the rigorous standards set by Mexican health authorities. Established regulations. Mexico has clear guidelines to ensure treatments are safe, ethical, and effective.
Pursuing stem cell treatment with Med-Mex. If you choose stem cell treatment for dementia or stroke, Med-Mex offers a comprehensive, turnkey service that covers your entire journey, starting with assessments and ending with travel and care arrangements. Cognitive mobility and medical assessments. The process begins with a cognitive assessment to evaluate dementia, mobility, and independence, along with a medical assessment of your medical history and any existing conditions. Treatment plan. Based on these assessments, Med-Mex medical staff determines your eligibility for treatment. If you qualify, they design a personalized treatment plan and provide a cost estimate. Doctor and hospital. Once you approve the treatment plan, Med-Mex will book the doctor and hospital for your procedure. They also ensure that the stem cells and exosomes produced by their in-house lab are ready and available for your treatment. Flights and hotel or resort accommodations. It starts with a flight from your nearest international airport. We book the flight business class. Med-Mex will arrange your stay at a 4-star hotel or resort in Mexico. All accommodation costs are covered, ensuring a comfortable and relaxing environment throughout your treatment. The only additional cost will be your meals, as food is not included. Airport pickup in Mexico. Our host will meet you at the airport and escort you to your hotel. You'll have a dedicated driver, translator, and concierge to assist with all your needs, whether it's attending treatment appointments, shopping, transportation, or arranging activities. Our team is here to ensure your comfort and peace of mind, allowing you to focus fully on your treatment and recovery. 2 quarterly assessments. After the treatment, Med-Mex will conduct 2 quarterly assessments to monitor your progress. Questions?
What are the possible side effects of the treatment?
Stem cell treatments for dementia are generally considered very safe, with thousands of patients having undergone the procedure with minimal risk. However, during the first 2 weeks after treatment, some patients may experience mild side effects, including fever and flu-like symptoms, which can be managed with over-the-counter medications, headaches and nausea, rare allergic reactions, such as itching and scratching, dizziness, lightheadedness, and fatigue. These symptoms are typically temporary and manageable, and can last for 1 to 2 weeks, with most patients recovering quickly.
How long does it take to see results?
You will begin to see results within 3 weeks, with improvement continuing over the course of 8 months.
What is the total cost?
The total cost for stem cell treatment, including 2 treatments of stem cells and 2 treatments of exosomes over 2 weeks in Mexico, as well as travel, accommodation, doctor, hospital, biological stem cells and exosomes, plus concierge driver and translation services, will range from $14,500 to $19,000 USD, depending on your neurological and medical assessment and the travel season.
How much does it cost if a companion or caregiver comes with the patient?
If you add a companion who will stay in their own hotel room, the additional cost for flight and hotel is $2,500 USD.
Where is the clinic?
The clinic is called Immunotherapy Regenerative Medicine, and they are located in Puerto Vallarta, Mexico. You can do a Google search and visit their website.
How soon can I book the procedure?
It takes a minimum of 2 weeks to make all the arrangements. Patients generally proceed with treatment 3 weeks after deciding to move forward. Thank you for your time. The next step is to complete your free medical and cognitive assessment. You can schedule it by text or call. To get started, simply text assessment to +1 2 2 6 2 3 9 6 6 0 0. We'll reach out to arrange a time that works for you. The assessment is completely free and can be done by text or phone with no obligations.